nurse with Sharp McDonald Center. Anthony, thank you so much for being here.
Wow.
It's a very alarming trend that we're seeing. I read the report by NPR. We're talking about the fourth wave. But first, we'll talk about opioids. They are prescribed to treat pain, but they become very addictive.
Yeah, so a lot of people will initially be taking it for pain, but start experiencing euphoria, and some people can start getting carried away with it and become addicted to it.
So let's talk about the fourth waves. One being that people are abusing prescription painkillers. Two, they're seeing that heroin use. And then three, the increase of fentanyl use. What is the fourth wave?
The fourth wave is the opioid epidemic being driven by stimulants, cocaine, and other substances tainted with fentanyl.
So it's a mixture.
Yeah, we're seeing an alarming increase in the amount of fentanyl being in stimulants, cocaine, and other substances.
We're seeing a high number of overdoses. For those who rely on opioids to treat pain, how can they test their medication?
So one of the most important tools that people can have are fentanyl test strips. You can get those online through Amazon, through needle exchange services, and also other websites online.
Now, what are some signs of an overdose?
Signs of an overdose, I like to keep it simple. If somebody has decreased or absent consciousness, or absent or loss of breathing, those are two telltale signs that somebody might be having an opioid overdose, and it's pretty important to act immediately.
And for those who rely on the opioids, what type of treatment plans are there for those who maybe need to cut back on medication use?
Usually we'll start off with an opioid detox that can include many medications. It really takes therapy and other treatment modalities in order to treat people with opioid use disorder. And there's various programs, including Sharp McDonald Center, for that.
We are hearing this report from NPR. This is a national report. What have you seen locally within Sharp, if you can share?
We've seen a lot of people come in that initially started out having an injury, start taking opioids for that injury, and then eventually later on start getting addicted to those substances, start going into other opioids like heroin, fentanyl, and eventually they have problems in their lives that lead them to get treatment, and usually they come to us for that treatment.
And what advice do you have for families and parents watching if their young adult or child is using opioids for pain? What advice do you have for them, maybe just to keep an eye and have that discussion with them about the importance of using it responsibly and to avoid overdoses?
Definitely take it as prescribed on the bottle. If you notice that there are more pills missing, or that the person's hiding their use, or they're doing things that seem like they might be using it in increased amounts, it's important to get treatment as soon as possible. And usually the criteria for a substance use disorder would be those things. That also includes that criteria.
Okay, and we're talking about those four waves. How does it even get to that point of mixing these stimulants?
Sometimes it is an accidental contamination. For example, they have a bunch of methamphetamine or cocaine, and then they have fentanyl, and it accidentally gets mixed in. And people that are using the other substances like stimulants, like cocaine, ecstasy, they're not expecting to get this fentanyl in their drugs, but they end up taking that substance and have an overdose because fentanyl and just a 2 milligram speck can be lethal.
I was thinking about all the teenagers or young adults who go to parties and maybe their friends say, hey, do you want a pain reliever? It's so important to never take a pill from anyone.
For sure. Definitely very important to be vigilant because any pill can have anything.
All right. Anthony Palladeno from Sharp McDonald Center, thank you so much for being here talking about the fourth wave and what we're seeing with this opioid epidemic.
For sure. Thank you very much for having me.
Our pleasure. All right, Logan.